Assalamualaikum doctors. In this video I am discussing about abdomen station, that is glycogen storage disease. So glycogen storage disease are how the clinical presentation: short stature, delayed puberty. They have liver and kidney enlargement. Remember, renal enlargement, liver and kidney enlargement, fasting hypoglycemia and hyperlipidemia and hyperuricemia. So mainly liver and kidney enlargement we find. They have chronic renal disease like liver adenoma and osteoporosis. Glycogen storage TT type 1B, that is neutropenia, neutrophil dysfunction, recurrent infection and inflammatory bowel disease. So let's what we find in abdomen examination. General examination we find pallor, no clubbing, plus minus jaundice, if LCF, short stature, small for age, doll-like face. Remember, doll-like face affected mentality and psychosis if affecting the brain. Bruise in the body, there is a bruise in the body. Local examination, what we find: abdominal distension, maybe spider nevi gynecomastia if LCF, scar for liver biopsy, huge hepatomegaly and nephromegaly. So huge hepatomegaly, nephromegaly, abdominal distension, maybe spider nevi or gynecomastia. These are we find doll face. 4 hypo, remember, hypoglycemia, hypotonia, hypomentality and hypocellular bone marrow. 4 hyper, that is hepatomegaly, hepatoma, hyperuricemia and hypercholesteremia. Again, local general features, what we find: general examination pallor, no clubbing, plus minus jaundice if LCF, short stature, small for age, doll-like face, affected mentality and psychosis if affecting the brain, bruise in the body. Local examination: abdominal distension, maybe spider nevi and gynecomastia if LCF, scar for liver biopsy, huge hepatomegaly and nephromegaly. Problem list are 4 hypos, that is hypoglycemia, hypotonia, hypomentality and hypocellular bone marrow. 4 hyper, hepatomegaly, hepatoma, hyperuricemia and hypercholesteremia. Now associations. What is association? Respiratory distress from hypotonia, CVS cardiomyopathy, CNS hypotonia. Vitals are infection and neutropenia in type 1B, cartilage dysfunction in type 1A, hypertension, nephromegaly and renal stones. History you would like to ask, like history of hypoglycemia, history of recurrent infection. So I'd like to complete my examination asking like history of hypoglycemia, history of recurrent infections. Bedside we are doing blood pressure and RBS. What investigation we do? First of all, diagnostic, we are doing enzyme assay in fibroblast, G6 phosphatase, maybe liver biopsy after discussion with the consultant. Lab full blood count 1A, decrease the platelet, and 1B, decrease the neutrophils with leukocyte adhesion defect. Increase lactate, increase the cholesterol, ureate and triglycerides. Renal function test and liver function test. Radiology we are doing abdominal ultrasound. Now about what is the treatment and advice we give. Treatment and advice: first of all, avoid hypoglycemia, no response to glycogen. So avoid hypoglycemia, provide continuous feeding and overnight feeding through NG tube, IV dextrose and corn starch. Then avoid trauma and inform the parents about the easy bruising due to low WBC and platelet. Avoid crowded places for liability to infections, bone marrow suppressions and leukocyte adhesion defect in type 1B. For hyperuricemia, follow with the dietitian allopurinol and increase water intake. For hypercholesterolemia, statins. For hepatoma, follow up with the and detect any changes. For cardiac problem, follow up with cardiologist. Genetic counseling. Definitive treatment is liver transplantations. Enzyme replacement therapy only in type 2 POMP without significant results clinically. So you understand glycogen storage disease, avoid hypoglycemia, continuous feeding, overnight feeding through NG tube, IV dextrose and cornstarch. Avoid trauma and inform the parents about easy bruising. Avoid crowded places for liability to infections. Then for hyperuricemia, they will follow the dietitian allopurinol, increase water intake. For hypercholesterolemia, statins. For hepatoma, follow up to detect any changes. For cardiac problems, follow up with cardiologist. Genetic counseling. Definitive treatment is liver transplantations. Enzyme replacement therapy only in type 2 POMP without significant results clinically. Of anemia and glycogen food elements and bone marrow affections. So anemia and glycogen storage disease because of chronic disease, because anemia of chronic disease, too much starch with no other food elements and bone marrow affections. There are some types, 6 types are. These are von Girk, Pompe, type 2 is, type 3 is Cori, type 4 is Sebi maybe, and type 6 are Hars. Okay, there are the some types of glycogen storage disease. So this is all about glycogen storage disease. Thank you.